Question, are you experiencing severe numbness, burning, tingling, weakness in your legs or feet? Well, it may be neuropathy. Dr. Keith Currie would like to send you a free report about neuropathy relief without surgery or medications. The Severe Neuropathy and Numbness Relief Guide is a $19.97 value, but Dr. Currie is going to send it to you for free. Just call the toll-free 24-hour recorded message to order your free copy. If the lines are busy, remember, as we always say, just keep trying. Now let's talk to the man himself about neuropathy. Dr. Currie, I have heard that many people have told that they're just going to have to grin and bear it, that they're going to have that neuropathy pain the rest of their lives, but they're going to be on medication the rest of their lives.
Yes, sir, and you know, if you look up those meds that they use for neuropathy, they're a lot of times anti-seizure, anti-convulsant medications, and so they're actually originally designed to treat seizure and convulsions, you know, and you know, they affect the brain. And so many patients will come in and say, you know, I don't want to be on, I don't want to feel like I'm a zombie every day for the rest of my life just to try to cover up this pain that's going on down in my feet. And when I say pain, pain can be described a lot of different ways. It could be tingling, it could be numbness, it could be burning, it could be weakness. I mean, there are a lot of different things when you say the word pain that can encompass. But, you know, those things, you know, I like to go to the root cause of problems. I tell people when I'm your doctor and you choose me as your doctor, you just hired me to be your detective. I'm a people mechanic, okay? It's like I'm your detective and I search out to try to go to the root cause of the problem, because I believe very strongly that when you have a tree and you come in and chop off branches by doing other things that are just covering symptoms up, ugly branches grow back in the place of the branches that you lopped off. Oh. But whenever you go to the roots, you're actually affecting things and possibly can make greater change. And so that's my goal with every single patient, is to try to go to the roots of the tree, get to the root cause of the problem, and then do something about that.
All right, that's a great analogy. Now, neuropathy, that's a medical term that everybody doesn't know, but you described it. I kind of gave a layman's definition. Can you give me the professional man's, the medical definition of neuropathy, so that these folks can just, you know, determine, well, I think I might have it, but maybe I don't?
Sure, Dave. You know, in Latin, neuro is nerve. Pathy is disease. Nerve, disease. And, you know, that's the big thing that I think that a lot of people don't really truly consider when they're hearing those words, is the true meaning of the words. And, you know, diseases don't just magically go away or get better. You have to do something. You have to take action. You have to try to interrupt that process somehow, some way.
It's called proactive.
Yes, and then it's just the decisions on what you make for yourself and for your life, whether you're going to do traditional things, you know, or whether you're going to go and try some different things like what I'm doing, you know. And you know, my patients make the decision to come to my clinic and go through my protocols, and thankfully it works for most of them. And you know, I can't help every single person, Dave, and I never claim to be able to do that. But I will say that most people who come through my clinic get a great deal of relief and improvement in their quality of life.
You touched on this briefly just a minute ago, but I think it's worth going over again. What is your professional opinion of some of the medications that you mentioned earlier to control neuropathy, or the pain of neuropathy?
Well, okay, you know, I'm a chiropractor. Chiropractors do natural things. Now, I don't do spinal adjustments or manipulations like most chiropractors do. People come to me for natural health care, and I do nutritional things. So, you know, yeah, I'm on the opposite side of the fence. I don't take medicines, and I don't ever plan on taking medicines. Now, that's a personal decision that different patients and different people have to make for themselves based on their recommendations from their doctor. But when someone comes to me, I'm going to say, okay, here's what we're dealing with, and, you know, here are some natural things that we can do to try to help you get healthier. I tell my patients, you know, if we work together nutritionally, if I do a blood draw on you and we do labs, okay, well, I'm not treating your disease, whatever disease you have. I'm treating you to help you get healthier, to help you get less inflamed, to allow your body to do the natural God-given processes that it's supposed to do, because the body can heal and repair itself if given the right opportunity.
If you are suffering from any of these symptoms that we've talked about, the low back pain, the sciatica, the neuropathy, just see Dr. Currie and call for that special report.